The vaginal ring, also known as the NuvaRing or the birth control ring, is a circular, flexible device that's about 5 centimeters in diameter and 4 millimeters thick. It is inserted into the vagina as a means of contraception. It contains a combination of synthetic versions of estrogen and progestin hormones that are naturally found in the female body. These hormones are absorbed through the vagina into the bloodstream. The ring prevents pregnancy by inhibiting ovulation and by thickening the cervical mucus to prevent the sperm from reaching the egg for fertilization. The vaginal ring protects you from pregnancy for 4 weeks. Once a ring is inserted, it will be worn continuously for 3 weeks. Then you will remove it for 1 week before starting another cycle. During the week without the ring, you will likely get your period. When a new ring is inserted immediately after taking out an old one, you will not get your period, and this is completely safe. With perfect use, the ring offers 99% protection from pregnancy. With typical use, the ring offers 93% protection. Inserting the ring is the same as inserting a tampon. All you need to remember is when to insert a new one and when to take it out. When inserted during the first day of your period, the ring will offer immediate protection from pregnancy. If you insert it at any other time during your cycle, you will need to use a backup method for the next 7 days following insertion. If you forget to take your ring out at the scheduled time and the 4th week lapses, all you will need to do is remove it and insert a new one. If more than 7 days since the scheduled time of removal has passed, you should remove it right away and insert a new one immediately, then use a backup method for the next 7 days. Once you learn how to insert it, the ring is pretty convenient. However, it is important to visit your healthcare provider before using this method so that they can determine if it is a good fit for you. There are 2 types of vaginal rings, the reusable ring and the non-reusable ring. After removal, the reusable ring is washed with water and mild soap, and then dried for use in the next cycle. After a year of use, it is disposed of. The non-reusable ring cannot be reused in more than 1 cycle, and you need to dispose of it after 3 weeks and use a new one after the 7-day break. Both rings are used in the same way. The vaginal ring offers advantages such as monthly protection from pregnancy, and though your partner may feel the ring during sexual intercourse, it will not harm them in any way. If you decide to get pregnant, your fertility will return as soon as you remove the ring. The ring can help to regulate your menstrual cycle and reduce ovulation pain, menstrual cramps, and symptoms of premenstrual syndrome. It has also been proven to reduce the risk of endometrial and breast cancer by 50%. If you have polycystic ovarian syndrome, commonly known as PCOS, the ring can reduce symptoms like excessive hair on the face and body. Using the vaginal ring may come with side effects like changes in bleeding patterns, breast tenderness, headaches, bloating, mood changes, and nausea or vomiting. These side effects will commonly disappear after your body has adjusted to the contraceptive. It is also normal not to experience any side effects at all. This is mainly because the levels of hormones in the vaginal ring are relatively lower compared to most of the other hormonal methods. In very rare cases, the vaginal ring may increase your risk of developing a blood clot within the first year of use. You should visit your healthcare provider if you notice any painful leg swelling, breathing difficulties, and chest pain, or if you are coughing up blood or have a feeling of numbness in the legs or arms. The vaginal ring is not a suitable method if you smoke and are over 35 years old, if you suffer from migraines, or if you are less than 6 months postpartum and are breastfeeding. The ring offers no protection from sexually transmitted infections including HIV, and so it is important to use condoms to stay safe. Learn more about the vaginal ring and other contraceptive methods by visiting findmymethod.org.